and associated disorders, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introduction of our speaker to Martha Butterfield, the program coordinator at NJCTS. Marty?
Kelly, thank you, and good evening, everyone, and welcome to our first webinar of the 2013-14 school year. When I was checking statistics today, I realized that this is our 49th webinar since we started presenting the series in January of 2008. For those of you new to our webinar series, I invite you to visit the webinar archive on our website where you can download without charge any of our previous presentations. In the past 5.5 years, we have had an outstanding group of medical and educational professionals address issues on a variety of neurological, parenting, and educational issues. In fact, this is Dr. Zambrano's second appearance in our series. He spoke previously in March of 2010 on parenting a child with Tourette syndrome and co-occurring disorders, and we are delighted to have him back. I'll get to his introduction in just a moment. Before I do that, I have a couple of things I want to call your attention to. The slide on your screen is about our 4th annual Mendham Walk on November 23rd. If you live or work in New Jersey or you're a close neighbor, please join us that day. If not, I hope you will log on to our website and make a donation. Funds raised by this walk will go to support our programming, such as tonight's webinar. The next thing I need to mention has to do with money. And I just want to say this so there is absolutely no confusion for anyone, that effective November 1st, we are instituting a $20 fee for webinar attendees who wish to receive professional development credits. So that means that our webinars will still be presented without charge. The $20 fee will be assessed only to those attendees who also request to receive professional development credit. Now, without further delay, I'd like to turn my attention to tonight's presenter, Dr. Robert Zambrano. He received his Bachelor's of Science degree from East Stroudsburg University in Pennsylvania, his Master's of Psychology and Doctorate of Clinical Psychology from the Graduate School of Applied and Professional Psychology at Rutgers University. He currently is in private practice at Stress and Anxiety Services of New Jersey, located in New Brunswick. Prior to this, he was on staff at the Tourette Syndrome Clinic at Rutgers University, their New Brunswick campus. Dr. Zambrano specializes in working with children and adults with OCD, depression, and other anxiety disorders, as well as Tourette syndrome. He has received certification from the Behavioral Therapy Training Institute through the International OCD Foundation. He is also certified by the Trichotillomania Learning Center to work with patients diagnosed with trichotillomania and other body-focused repetitive behaviors. Dr. Zambrano does presentations for educators and professionals across the state on behalf of the New Jersey Center for Tourette Syndrome and for OCD New Jersey, where he also serves on their board of directors. Now, without further delay, I'm pleased to turn tonight's presentation over to Dr. Zambrano.
Good evening, everybody, and thank you, Marty, for that lovely introduction. As you can see from the screen, I am Dr. Rob Zambrano, and tonight's presentation is on dealing with school refusal, focusing on proper assessment so that we can tailor interventions to the reasons for school refusal. Now, when you work at a place called Stress and Anxiety Services of New Jersey, you tend to attract a lot of clientele that have major anxiety issues. And so in the many years that I've worked for this practice, I've come across a lot of school refusal cases. Quite often they're often steeped in anxiety-related issues. And what I've found over the years is that school refusal tends to be one of the most humbling and difficult issues to deal with because it's so multifaceted. It's rarely, in fact, it's never just an individual therapy case. It's always a combination of individual therapy, family therapy, and coordination with other agencies such as the school, and sometimes co-therapists in the process of working with children who engage in school refusal behaviors. So unfortunately, this evening I'm not going to be able to give everybody an answer tailored to everybody's specific issue and why they're coming into this presentation. So I'm looking at this as more sort of an initial sort of starting the conversation and informing people of what they need to know to start to tailor the interventions. But as I said, this is a very humbling issue to deal with in that the success rates aren't always as great as we'd like to see, but we put forth our best effort and hope for the best results. So without further ado, let's move on to the next slide. So the goals for tonight's presentation. First of all, we want to start by defining school refusal. We're going to learn how to assess the reasons for school refusal and learn which interventions are appropriate for which particular reasons. So this isn't sort of a one-size-fits-all approach. There's often many different reasons for why somebody refuses to go to school, and if we use the wrong approach for the wrong reason, then we often get counterproductive results, and that can backfire and actually make the problem worse. So that's why I always emphasize assessment as a part of this. Now, what's interesting is when I was originally approached by the New Jersey Center for Tourette Syndrome about doing this presentation, the original title of this presentation was Getting Kids Back to School. And I actually contacted NJCTS and I asked them to change that because as a therapist, my goal isn't to get the child back to school. My goal is to teach the child coping skills to help them make the choice to get back to school. So we focus on the process of helping people deal with the reason for why they're not getting into school, rather than making it the goal to force them back into a situation that they may not be equipped to deal with. We also have to work on differentiating the family's role from the school's role while having both work together effectively. And we'll go into more detail as to why this is also a crucial step. We're going to identify appropriate behavior management methods for dealing with some of the issues that come with school refusal behaviors. And as we said, we're also going to identify appropriate accommodations, not just from schools, but from families as well. And make sure that we're not over-accommodating, which sometimes is an issue that occurs with school refusal. I should also warn everybody that I'm getting over a cold, so if you suddenly notice my microphone cut off, it's probably because I needed a few seconds to cough. So be patient if I disappear for 5 seconds every now and then. Anyhow, so the definition of school refusal. For the purposes of this presentation, we're talking about being completely absent for many days, attending school but leaving early or skipping certain classes, experiencing chronic tardiness, a student who attends school but only after intense resistance to getting into school, and so on a daily basis, the family having to sort of go through a crisis type situation to get the child into school, or the student into school, I should say. And the student displays unusual amounts of stress during the day that leads to pleading to future missing of school. Exceptions to the definition. In the case of someone having a legitimate physical illness, that would not be a situation where we would consider the behavior to be school refusal. Now, by legitimate physical illness, what I mean is, for example, somebody a child perhaps who has Hodgkin's disease and has to miss several days because he's been hospitalized getting chemotherapy treatments, or this needs to be in a sterile environment. Clearly, that would be a legitimate physical illness that we would not consider school refusal. Now, where this can get muddy is that many children I've worked with over years do have physical symptoms that result from their anxiety. So let's say stomach problems, major headaches, even dizziness and blurred vision can sometimes be a somatic symptom, a symptom that is caused by psychological distress. In that case, we wouldn't consider it a legitimate physical illness. We would say that we focus on skill building and helping the child deal with the reasons, the origins of that problem. But for the purposes of today's discussion, we're not considering that in terms of the legitimate physical illness. We're talking about a physiological origin rather than a psychological origin to illness. Severe psychiatric illness would be an exception to the definition. And that would include not just, so we're not just talking schizophrenia or bipolar disorder, but we would include severe depression and suicidal ideation. And I would consider panic disorder at certain levels to be considered a severe psychiatric illness as well, that can be debilitating. I've worked with adults who have had to take leaves of absences for a month from their job because their panic disorder is so profound. I've had people who've had to quit good jobs because their anxiety was so severe. So, we keep in mind that full-grown adults who, aren't always equipped to handle this level of anxiety, and to have an expectation that a child should just suck it up and make it in to school may not always be a healthy or realistic expectation. And we'll talk more about that as well. And of course, when we talk about suicidal ideation, we don't want to confuse that with a child who's depressed and saying, I'd rather die than go to school. Or even a child who has passive suicidal thoughts like, that I'm miserable and I wish I wasn't alive anymore. In this case, suicidal ideation, we're talking about a child who's making threats to harm him or herself, who has actually a history of harming him or herself, or that has an actual plan for how they might do harm to themselves. So that's what we talk about with suicidal ideation. Another exception would be a major family disruption, so a death in the family, loss of housing, etc. So those would be situations where clearly we wouldn't consider the behavior to be school refusal. So we mentioned assessment at the top of the presentation. Before we can begin to effectively intervene with school behavior, we have to assess why the student's refusing to come to school. And part of doing that is you have to assess that, again, we have to pick the right intervention. We can't pick the right intervention if we don't know the reason for the school refusal behavior. You also need to assess the student's motivation to deal with the problem, because that often sort of determines the course of treatment and how things are going to go. This is often, not always, easier if you have a motivated student, somebody who wants to go to school like their peers, but is having a very hard time overcoming their fear. At least now we have something to work with. Somebody who has gotten to the point where they've become hopeless and given up, who says, yeah, I'd like to return to school, but it's too hard and I don't want to even try because it's just, I know I'm not going to be able to do it. Then we have to sort of address confidence and motivation issues. How to assess? Well, you'd be surprised at how many people have called my office with this kind of, with this kind of issue. Their child is refusing to go to school or highly resistant, and when you ask the parent, well, does your child tell you why they're so anxious about going to school? And every now and then I have the parents say, well, I have no idea why, and so that sometimes tips me off to perhaps some damaged communication or ineffective communication between parent and child. On the other hand, very often the child can't quite explain why he or she is having such struggle. All they know is they're experiencing something intense. They can't explain what's going on, and so sometimes, especially with younger children, we may have to sort of do some guesswork for them and, throw out some hypotheses for them and see how they respond. Oh, yeah, it might be that. Oh, no, I don't think it's that. That sort of thing. So part of the assessment process, and maybe helping the child figure out what's going on with him or her, is finding out what the teachers have observed in class. Does the child seem highly anxious throughout the day? Now this could also be sort of a somewhat confusing factor, in that I have had clients in the past where teachers tell me, oh, the student seemed perfectly calm. I don't know, what they're talking about. He doesn't seem anxious at all. I've worked with a number of people who are extremely anxious, but also extremely good at hiding from others how they're feeling and not letting other people know. And this is where things can get confusing and messy with the schools, because they might start to think, this kid doesn't have a problem. This is just a kid who doesn't want to be in school. And so that can become a problematic mindset for the school to have. Excuse me. We also have to help the student understand that if they cooperate with the assessment process, that everyone involved will do their best to help address issues raised. Now, sometimes kids won't cooperate with, because they have a sense, they know that the adults have a goal in mind, and their goal is to get them back into the school. And so, if some kids figure out pretty quickly, oh, well, if I cooperate with this process, if I explain to them what's going on, they're going to, this is all prelude to try to get me back into the school. So which is why with my clients, I really do emphasize, not just with the student, but in front of the parents, that my goal is not to get you back to school. My goal as your therapist is to help you deal with your anxiety so effectively, or increase your motivation significantly enough, that you will make the choice of whether or not you want to go to school independent of any anxiety. So you make a choice regardless of fear. Now, of course, we also have to sort of set reasonable expectations, which is, a therapist and a family and a school can do everything correct, and ultimately it's up to the student to be willing to accept that this process involves feeling anxiety, but coping with it more effectively, rather than sort of having an expectation of, oh, we're going to teach you these techniques so you don't have anxiety anymore, and then you'll be able to go back to school easily. That's not our goal here. It's really, again, just to sort of give the child confidence that he has the tools to handle the anxiety or whatever issue is going on so that he can go back to make the choice to go back to school. And again, so the reason I'm sort of elaborating on this so much is I think it's important that the child feel like we're listening to him or her, that we want to understand why they're not going to school before we launch into accusations of them being lazy or undisciplined or oppositional or terms that often get thrown at kids like this. We want to start from a very kind of open and understanding point of view that's welcoming of help me understand this. And I've even said recently, with a parent in the room, I've said to the child, if you can help me understand why you don't want to go to school so intensely, maybe I can explain that to mom and dad and they'll back off and leave you alone. Now, we accept that that's not the parent's goal, but if the child can accept that I'm his advocate and that I really just want to hear, and maybe you have a good reason, that can get them talking, because this conversation, this assessment is crucial to doing as well. We also though explain that if the student is non-cooperative, right, then now their feedback in the process is not going to be a part of the process. That, if you let us know what is going on that's making school so hard, perhaps the adults involved can do things to make school easier. If you don't let us know, we're going to assume you're just being oppositional, in which case we are probably going to force you to do things that you don't want to do. But that's never the best case scenario. So we can hold that as the adults, we can hold that as leverage. That, if you're not cooperative, then there's consequences for that. On the other hand, if we believe that you're trying, you're at least making some effort, then we're going to be really patient and understanding. So what do we assess? We want to assess the child's temperament. Is this a shy person, an outgoing person? That obviously sort of will tell us something about what's going on. Does the child have self-esteem issues? What is the child's social status? Now, we can't just assume that just because that all the kids who engage in school refusal or people who are being bullied or who have low self-esteem, very often, being a popular kid, being somebody who's the center of attention comes with a lot of pressure as well. And I've worked with kids where parents are really surprised, and they'll call me up and say, I don't know why he doesn't want to go to school. He's the captain of the soccer team, or she's like the head cheerleader, or she has lots of friends. She's really popular, and when she's out of school, she seems so happy. So we can't just assume that this is always the kid who is the isolated, shy, awkward type. That doesn't always tell us something, but knowing, again, some of the social status helps us formulate what's going on and come up with interventions. By physical status, of course, what I'm talking about is the child on the short side. If we're talking middle school, is this a late bloomer versus an early bloomer? Are they concerned about sort of getting undressed in the locker room? In which case, there's some instant where we can come up with some accommodation ideas. We have to make sure that the child has been assessed properly for cognitive abilities and learning disabilities. Often, these are things that aren't identified until later on in school when school gets more challenging. So some kids can be very bright but have learning disabilities that go undiagnosed because how bright they are sort of kind of masks the struggles that they're having. What are their communication skills? Are they able to communicate to the teacher their needs, their concerns? Are they able to advocate for themselves with peers? These are all things to assess. Has there been some sort of traumatic life event recently? What's the child's relationship with the parents? What is the marital status of the parents? Because, crisis at home sometimes, again, tells us, that maybe the child is dealing with anxiety and taking whatever's happening at home into school with him and, not functioning well there because he or she's preoccupied or anxious about not being around mom and dad, or thinking about something happening with mom and dad. Parenting style is important to assess, especially if the parents are not on the same page. I've very often worked, in fact, more often than not, actually, with cases like this, where one parent is the accommodator, one parent is the soft touch who, lets the child stay home from school and it's okay, we're not going to make you go. But the other parent might be at the other extreme of, oh, no, absolutely, you're going, and then there's a lot of fighting and conflict and what have you. We have to make sure that the parents are unified and effective. We're going to talk a little bit more later about how do we make that happen. Is there a family history of mental illness? Of course, that's something we certainly want to assess because that's going to be a very quick indicator of what might be going on with the child that is leading to the school refusal. Other important things, this information, is there some sort of pattern to why the child misses school? So if the child is missing school on days of tests, well, then maybe it's performance anxiety. if the child is consistently missing school on days that he's supposed to give presentations, maybe it's a social anxiety issue. Maybe the child misses school on days where the routine is broken up. So perhaps is this one of these children in the sort of pervasive developmental disorder area where they don't handle well with transition or things not being sort of routine on a daily basis. So all these things can be indicative of what's going on. We also want to know if the student is contacting the family a lot throughout the day. This is something I try and discourage as much as possible. Because I think by allowing a child to have constant contact with the parent throughout the day, what we're not doing is committing to accepting being in school and dealing with your anxiety more effectively. What ends up happening is the child outsources their well-being to somebody else. They end up depending on somebody else to calm them down and tell them everything is okay. And as a therapist, it's my job is to help the student learn to be able to do that for themselves. And I find that children don't often work on self-soothing themselves if they have somebody else doing it for them. So this would be the kind of thing that I would discourage, but we would want to find out because it could actually be potentially maintaining the anxiety throughout the day rather than having the child sort of accept in a very sort of complete way that I'm in school now and I have to just accept that mom's not going to pick up the phone or dad's not going to come pick me up right away if I call him or her. Now, this can be complicated because with panic cases, the idea of being trapped somewhere can make panic worse, and perhaps knowing that I can call dad and dad will come pick me up, there's an argument to be made that could help deal with the panic because they know they're not actually trapped. But on the other hand, we can say the counter argument is, again, it makes it too easy for the child to escape the situation, which is maybe something we don't want to have happen. We want the child to experience dealing with their anxiety in the moment and gaining confidence that they can deal with it. But we're going to talk more about how we do that. We also want to know if the child is attending school on special days. So if the child is engaging in school refusal but makes it in for taco day, then that might be sort of more of an indication that there's some oppositional kind of flavor to this, or there's just sort of more of it's less of an anxiety issue and more of a behavior or bad choice making, that sort of thing. Is the family overusing rewards? In other words, is the child so used to having to be rewarded for normal behavior that now they're taking advantage of that and refusing because if I refuse, then I'll force them to give me something, and so it becomes a negotiation. We're hearing a lot in the news about hostage taking. I've seen children take their family hostage. I won't do this unless you give in to my OCD. I won't do this unless you do my homework for me. I won't go to school ever again unless you promise to reward me for a daily attendance. So we want to make sure that that rewards aren't part of some sort of hostage-taking negotiation. We also, as I mentioned earlier, we want to assess if there's an actual physical illness versus sort of a psychological origin to a physical symptom. And of course, always err on having a pediatrician be involved in this. I would never ever tell a parent, oh, these symptoms are just psychological and they're not real and you should ignore them because God forbid we miss an actual physical problem. And so if a child is constantly sick, this should be a child that maybe should have some blood tests done or some other examinations done to make sure that there isn't actually something physically wrong that we're ignoring and just assuming it's psychological. And of course, a sudden change in behavior at home or in school is something we'd want to observe as well. Was this some sort of trauma? Did something happen that that's just making it harder for the child to focus and function overall that we need to be addressing, and it's not actually directly related to school, but some other major life event or crisis? So the four things we want to assess, the four areas we want to focus on are why do students refuse school. And the reasons we're coming up with is to avoid school-related stimuli or situations that provoke negative feelings, to avoid dread or anxiety, to avoid aversive social situations and evaluation, to obtain attention from significant others, and to obtain the tangible rewards that come with staying out of school. So let me go back for a second. I'm probably going to zip through some of these slides just because this is a 2-hour presentation that I'm trying to cram into 45 minutes. So I believe, if I'm not mistaken, you guys might have access to the PowerPoint if you want to go through the slides more slowly or thoroughly. Anyway, let's skip that. Why not? So I'll quickly just let you guys know that that typically for ages 5 to 11, children tend to refuse school more often because they're seeking parental attention or avoiding anxiety. Whereas typically ages 12 and up, school refusal is more about social anxiety, panic issues, or more of an oppositional kind of trying to obtain the tangible rewards of being out of school. For children below the age of 12, treatment tends to be more behavioral in nature, and children above the age of 12, it's more cognitive in nature, and I'll explain that distinction in a moment. We also want to make sure that people aren't getting stuck in the blame game. Very often, and this is where things fall apart very early, is the school will make an assumption that the student just has a bad attitude, that the parents are overly coddling and not pushing the child hard enough and being irresponsible, and don't see the level of crisis the family's experiencing at home. On the flip side, the parents may sort of ask for certain accommodations, and maybe what they're requesting might not be reasonable, in which case they sometimes slip into the school doesn't care about my student, doesn't care about my child, they're sabotaging him, they don't like me, and so that's why they're not being more cooperative. So we want to make sure that everybody works together and assumes that the whole team wants the child to succeed and do well, and accept that we may have different ideas about how to do that, and the school may legitimately have limitations as to what they're allowed to do. So for students who avoid school-related stimuli, we're talking about avoiding panic, anxiety, generalized anxiety, specific phobias, and depression. Now, how do we deal with that? Now, I'm what's called a cognitive behavioral therapist, so I practice CBT. And so I'm going to go over very briefly a CBT protocol for dealing with these issues. So very quickly, I'm not going to have time to go into a lot of detail. We first teach them relaxation skills, so breathing techniques, meditation, muscle relaxation, guided imagery, sensory grounding. So the kind of thing that I think most good therapists do, even non-cognitive behavioral therapists do this kind of work. So we want the child to feel equipped that, oh, I'm learning tools to better manage my anxiety. Cognitive therapy, that's the C in CBT. With kids, we also refer to it as detective thinking. So it's learning to identify thoughts that fuel scary feelings, using evidence to decide if the thought is distorted or accurate. And if the thought is distorted, we challenge the thoughts, and if it's not, then we work on problem solving. So let me give you an example. So let's say if a child says, I'm afraid to take my calculus test. So that's a situation that arouses anxiety. So I'll ask them, okay, what are you feeling? They might say frustrated, anxious, and depressed. And I'll ask them, what are you thinking that makes you feel this way? And they might have thoughts such as, I'm stupid, my parents are going to be disappointing me, I'll never get into a good college. So I'll ask them, what is your evidence? What are your grades like? Very often the students who are very hung up and super anxious about, failing a test are the kind of students who always get A's anyhow. So, how do your parents react to previous bad grades? If they're very concerned about somebody evaluating or judging them, well, how would your parents react if you got an A? We want an honest evaluation of this. And then asking them, will one test make or break your future? How likely is it that somebody who gets straight A's is going to fail the next test? And if you did, what would happen? So we teach them more realistic thinking. So we teach them statements like, my GPA is solid, my parents are fair, and I probably will not have my future determined by this one test. I've literally had students in my office telling me that if I fail this next test, how do I know I'm not going to fail all of them, and then I won't get into a good college, and I'll end up homeless. And so we have to sort of help them back off from distorted catastrophic thinking, and this is how we do it. Problem solving, we get a tutor. Let's say the family is putting extremely high expectations on the child. Then, we bring them into as part of therapy and explain to them how their expectations, although maybe good and healthy, are not having a good and healthy reaction on the child. And so they may have to sort of change how they deliver messages about expectations and sort of emphasize more healthy living rather than achievement living. We engage in exposure. So we gradually expose the student to a feared situation, and we use the skills that we previously talked about to help them deal with the fear that's going to be aroused when they're in those feared situations. So we teach them relaxation. We teach them when you do exposure and you're feeling anxious, use that relaxation, meditation skills that we taught you. Use the ability to challenge your thoughts. Now, often people aren't very effective at challenging their thoughts if they're in a state of panic. So, we want exposure to be gradual. So we want them to feel some level of anxiety, be in touch with what they're telling themselves when they're highly anxious, and learn how to challenge those thoughts effectively. Again, so the hierarchical approach is shaping. So we reward school attendance, but maybe we have to shape the behavior slowly. So we shouldn't have an expectation that, a child who's missed several weeks of school will learn therapy skills and then come back to a full day of school on Monday. It might be just that, literally just, can you get out of bed, get dressed, and get in the car before you make the choice of whether or not you're going to go to school or not. And if you make it into school, can you then stay in homeroom for 5 minutes? And if you've achieved that goal, now the choice is up to you as to whether or not you stay in school. We hope you stay, and if you stay longer, we might reward you for that. But if you can't stay, okay, fine, that means we've drawn a new line. But every day you're expected to at least stay for 5 minutes, and the assumption is you do that on a daily basis. Eventually it gets easier, and eventually you can increase the amount of time you spend in school by 25% of the time. So 5 minutes I'm not going to do the math, but let's say 5 minutes jumps to 7.5 minutes, et cetera, et cetera. So we also often encounter with school refusal cases that Sunday nights kids get really worked up and anxious. And so we want to make sure that kids stay busy on the weekend. We want to make sure that they get their homework out of the way on Friday, even if they might be highly resistant to the idea. Often kids will tell me, oh, I spent the whole week at school. I don't want to do homework on Friday. And yet, undone homework simply becomes this shadow that hangs over them all weekend. So better to get it out of the way if at all possible. And then keep the child busy throughout the week, especially on a Sunday. This works more effectively with younger children. Just keep them distracted and prevent them from sort of working themselves up with catastrophic thinking. Excuse me. Okay, so some of the accommodations we can provide is giving a student a pass to go to a safe place when they're in a state of panic or hyperanxiety. Maybe a supervised place where somebody can sit with them, or just a quiet place where nobody's actually going to talk to them or intervene with them so much as, okay, here's a quiet place for you to practice your skills. Because very often what ends up happening is a child will leave the classroom, go to the guidance office, and the teacher will, the guidance counselor might start grilling the student with, did you try this, did you try this, what's going on? Rather than just sort of backing up and letting him or her slowly work on calming himself down and then talking. So, this is something I advise the schools to do. But if the student is going to meet with you, just literally emphasize first calming down before you talk about things, because often talking about it just ramps up the anxiety and leads to ineffective problem solving. If the child is buckling under the pressure of testing or is feeling overwhelmed that I won't have enough time, perhaps we can give extended amounts of time or even reduce workloads while the student is building up their ability to deal with their anxiety. And of course, as you hear all the time, assess for possible bullying, because that's something that needs to be addressed if it's one of the reasons for avoiding school. So moving on to the other area, so we're not talking about panic so much as panic disorder or unpleasant physiological symptoms that you experience by going to school. Now we're talking about students who avoid social situations. So these are people who have social phobia, depression, possibly have suicidal thoughts, self-esteem issues, excessive parental expectations. By the way, any of these terms that I give you that are psychological definitions like social phobia, depression, generalized anxiety disorder, at the end of the presentation, I'm not going to read through them, but I have about a series of 7 different slides giving a full description of these disorders in case anyone needs that. So once again, we follow a CBT protocol similar to what I just described when we're dealing with students who avoid school because of fear of social evaluation. But the primary focus is often on skill building, behavioral activation, and cognitive therapy. So, the child who is overly worried about what if I make a mistake, part of therapy is maybe making a mistake on purpose in front of people and seeing what it feels like, showing yourself, can you handle the anxiety? Can you deal with embarrassment effectively? And then, using all those other skills, we teach children to sort of, to give them confidence, okay, that maybe I could handle it, but if it does happen, it wouldn't be the worst thing in the world. So that's skill building. But we might also talk about some of these kids might have actual real-life social skills deficits, in which case, we can't just ignore it and say, oh, you're just being anxious. We may have to teach children how to socialize more effectively, so there might be a lot of role-playing involved in the treatment. Let's see. So let me keep moving. Some of the accommodations for that might be preferential seating. So especially if the student might need to leave the situation because of elevated anxiety, we might want to have them seated closer to the back of the room. We want to also evaluate what is the teacher-student relationship. So if the student's very concerned about the teacher's judgment, and maybe it's an accurate concern that maybe the teacher tends to be judgmental and harsh, then we might want to address that relationship and sort of help the teacher understand how their teaching style might be sort of setting off some of these insecurities in the child. If a child is overly concerned about being called on in class, maybe we give them the option of, let me raise my hand rather than have to deal with the anxiety of, oh my gosh, what if the teacher calls on me? Which is actually a very common thing. That often teachers will randomly pick somebody to try and answer a question, and these students often dread the idea of not knowing something, being embarrassed, not having an answer for something, appearing stupid, all those things. The therapist's job is to help them sort of get over that fear, but the teacher's job is to, in this situation, their job isn't to be the therapist and expose the child to that. Their job is to sort of accommodate and understand that I don't need to call on this child unless they raise their hand and volunteer to do that. And hopefully for therapy, I can get people, I or any therapist working with a child can get them to volunteer to do that every now and then, because that would be a good exposure exercise. For in-class presentations, we might have the student use alternate assignments. So give a video presentation and you can hand in a disc to the teacher. Maybe some sort of any kind of alternative project where the child doesn't have to present in front of a classroom. Maybe coming in after school and giving the presentation only to the teacher. These are all things, of course, we hope are temporary accommodations. Issues that fuel social anxiety. Does the student have a recent breakup or falling out with a group of friends? Does the student have a crush on someone in class? That can make somebody kind of anxious. As I mentioned earlier, is a locker room an issue? Do people have body insecurities? And that might be something that they're avoiding. Does the student have a secret they're afraid that someone else will discover? Since I'm speaking on behalf of New Jersey Center for Tourette Syndrome, often I've worked with kids who have Tourette's, but it's very subtle Tourette's. They might have mild motor tics or subtle vocalizations that they can disguise as throat clearing or coughing. And yet they'll live in this constant state of fear that somebody's going to find out they have Tourette's. In that case, I think the best thing to do is just come clean and let people know what your secret is, because more often than not, if we can educate people properly, then the secret ends up not being that tormenting. And if there is any bullying, then we teach the child and the school to deal effectively with said bullying. But often it's better just to sort of disclose than to sort of live in fear of a secret being discovered. Now, of course, we want to take into account the environment. So, for example, a person who's afraid, who's homosexual, who's afraid that someone will discover they're gay, depending on the environment, that might be a wise thing to sort of not share that if people are going to bully the child and the child isn't equipped to deal with the bullying. So, it's something that we want to take on a case-by-case basis. All right. Now, the third category for students who want to obtain tangible rewards. I'll let you guys read what's on the screen, but essentially what we mean by that is these are students who, basically are more in the oppositional realm and whose school refusal behavior is being reinforced by the fact that I'd rather stay home and play video games. I'd rather, leave school early and go hang out at my girlfriend's house or something like that. That's what we're talking about here when we define tangible rewards. So there's something that they get that's reinforcing that maybe even makes it worth it for them for any sort of punishment or consequence that they get. So let's skip through that. So for students who have these issues, we want to focus on interventions on helping the parent and student effectively negotiate solutions to behavior problems. We want to design written contracts between parents and students and give the student space to air out his or her point of view on things. And we also want to assess the student's ability to their peer refusal skills. In other words, maybe they're involved with somebody who's a bad influence on them. They might actually want to go to school, but they don't know how to say no to their friend who wants them to cut school. So teaching them role-playing with them how to do this more effectively could be very helpful. Addressing motivation issues. So we want to find out what's the family's response to noncompliance. What fears does the student have about compliance? Do we reward positive steps but without renegotiation? So in other words, sometimes one of the things that I say that a family should at the very least demand if a child is engaging in school refusal behavior, at the very least they have to get out of bed, they have to get showered, they have to try and eat breakfast and get in the car before they are allowed to make any decisions about whether or not they're going to go to school. And that's often sort of the minimal expectation. And if the child isn't cooperating at that level, and there's never any excuse, I've never come up with a good excuse for a child not being able to do at least that, then we're considering this non-cooperation, in which case there can be consequences. Some sort of privilege should be withheld, and you'd be surprised by how many parents I've worked with over the years who are terribly ineffective at enforcing consequences. They do the whole I'll ground you for a month, and then the child raises hell, and the grounding lasts an hour. So we want to help give the parents the voice to be effective in enforcing these consequences. And often with these kind of behaviors, we might have to start with non-school attendance issues, which really seems kind of weird because everybody's constantly worried about having the child get back to school right away. But if we have an oppositional kind of kid who isn't terribly motivated, sometimes what we can do is we can say, if we address some other problem that is causing conflict and strife within the family, and the child sees, okay, by addressing this and backing up on the school issue for a little bit, but sort of addressing this, I think of a kid I worked with not too long ago who that was the case in his home. They were constantly fighting about school attendance and 12 other things. We put school attendance on the back burner, and we helped the family be more effective in negotiating with each other, communicating more effectively, and suddenly the fighting stopped. And suddenly the kid, his oppositional nature kind of softened a little bit because his parents stopped being the enemy for him to oppose and piss off on every turn that he could, and suddenly, okay, I guess they're not so unreasonable, and it's pretty normal for a parent to want the kid to come to school. And then, once we get past all that sort of oppositional kind of conflict, back and forth battling and jockeying for position, then we can address the school issue perhaps more effectively.
Dr. Zambrano, if you could speak up a little, you're
Yes.
starting to fade.
Sure thing. I'm going to move the microphone a little closer as well. Okay, so the last category that we were talking about is for students looking to obtain attention from significant others. These are typically kids who have separation anxiety issues, but also oppositional defiant disorder. And as I mentioned earlier, this is far less common in high school, the whole separation anxiety. These are kids who basically want to be close to mom and dad because they feel afraid when they're not around them. So in this, especially with younger kids, the focus of treatment is more on parenting issues, increasing attention for positive behaviors, and dealing effectively with negative behaviors. And for the most part, what I mean by that is ignoring most negative behaviors. Certainly we have to have non-negotiables. So if the kid decides to set the car on fire, we should probably address that. But if the kid is just having a tantrum and trying to get our attention, as much as we can, and as hard as it might seem, we should walk away and ignore it and let the child sort of get it over with. And then we go back to rewarding them when they're being positive, So that might be hard. So a kid might be having a tantrum, but then suddenly he quietly picks himself up and reports to the breakfast table and starts having breakfast. You may have to praise that child for saying, I'm really glad you were able to pull it together. Good job. I'm proud of you. That may feel weird, but again, what we're not doing is we're not reinforcing the negative behavior with attention, and we're reinforcing the positive behavior. So this may feel like very young when I'm talking about, because these interventions are tailored more towards younger children. We also want to establish a fixed daily routine that the student can keep to if the student stays home. Now, this is always, of course, a scenario we'd want to avoid, but if the student stays home, we want to, and there's a slide coming up that'll explain it further. We talked about that. So in helping parents be more effective, we teach them to not phrase commands in the form of a question. So not, do you want to go to school today, but, okay, get up, time to get ready. Does a parent slip into lecturing or repetition? We want to avoid that as well. We give clear commands, and we give them once, and we don't warn 12 times. Okay, you better do this time. Oh, not up. Don't you do it again? You're punished. Okay, only one more time. That's where we get into trouble, and the sort of commands become jokes. So actions speak louder than words. So we give a command once. We let them know what the consequences for not following through with the behavior, and then we enact the consequence. But we also want to choose our battles. I worked with a family a while back where the daughter would play video games before school. And this was really important to her, but the family didn't want to let her, and this would turn into fighting and fighting and fighting. And instead we actually managed to negotiate, okay, she's allowed to play for 15 minutes before school, and if they tell her to stop, she doesn't have to stop immediately because she might want to save her game, but if she doesn't stop within 5 minutes of them telling her to stop, then there's a consequence. So, we helped the parents be less rigid, and suddenly there was a lot less fighting, and the kid got back to school with less resistance because now they weren't having a morning battle where her resistance was getting activated and engaged. Is the morning routine doable for the students? So let's say this is not a morning kid, and we want to maybe get their clothes ready in the evening, maybe take a shower at night instead of in the morning, that sort of thing. Maybe if they run short on time, let's not make this a high-pressure thing. If the kid misses breakfast, I promise you he won't starve to death. Maybe you have some Pop-Tarts ready to eat on the bus or in the car ride. And we don't use guilt as a motivator, so we shouldn't do the whole, if you don't go to school, you're going to make mommy and daddy feel very sad, because then that becomes a weapon that the child can use against the parent, especially if they want to hurt the child, if they want to hurt the parent, especially if there's an oppositional streak there. I know I'm moving quickly, but I'm conscious of the fact that we only have so much time. For students looking to obtain attention, parents should not skip work. They should escort the student to school and volunteer to be school. They should not escort the child into the school if at all possible, or volunteer to be an aide or anything like that. This only reinforces attention-seeking behavior. The parent can agree to walk the student to a designed spot and then have a trusted person come meet the student and then walk the student into the building. But the more that the parent is suddenly entering the school grounds, the more we're diluting the school's authority, and the more that the child is saying that they have some sort of manipulative power here. If possible, parents should arrange for somebody else to be with the student if, in the event they're unable to get him or her to school. And that person shouldn't be lavishing a lot of attention on the child as well. If in younger children, if the parent is only able to get the child to attend if the parent comes with him or her, and again, we want to avoid this, it should be a last resort. But it might be, okay, if the only way to get the child into the school is to have the parent come into the school, so be it, but then we progressively work on reducing how far the parent goes into the school, how much time the parent spends in the school. So we want to sort of scale back slowly, but of course avoid this if at all possible. If the student uses a tantrum to avoid to manipulate, the student should be given as little attention as possible. And again, we want consistent follow-through on consequences. Don't say you're going to take away something or punish if you don't actually do it. Fighting with your student is reinforcing because that gives attention. Be willing to let them stay home. Be willing to let them lose the battle, but enforce the consequences if they don't give you attention. So they have to see you're serious. So especially at a certain age, they become too big and cumbersome for us to drag into the car or fight with on a daily basis. All we can say is, when I mean be willing to let them stay home, they said, look, we want you to go to school, but if you do not, understand that there will be no video games and no TV until you make the choice to return to school. Now, I've had a number of parents who try and convince me that their child is the most stubborn, hard to get to, will never, ever, ever give in, ever, child in the history of the world. And I'll ask them, have you tried what I've talked about? And they say, no, I didn't try because I know I can't win that battle of wills. We have to give the parents the strength and the confidence to know that they can, which means, again, if the child locks himself in the room and starts watching TV, then learn where the circuit breaker box is in your basement and turn off the power. Maintaining a school schedule, I mentioned this earlier. So if the student does stay home, he should not have access to anything he wouldn't be allowed to during school. So no cell phone, no TV, no video games, etc. During school hours, the student should be doing academic work. So if the student stays home, the only thing he's allowed to do is to do school work. Lunch and break time should happen at the same time they do at school. And food options at home should be similar to school options as possible. So again, we want some sort of consistency. So if it's fish stick day at the cafeteria at school, then you get fish sticks for lunch. But at the very least, we don't want to stay home and you get a gourmet meal because that's what they enforce. Forced attendance. When do we force attendance? Only if school refusal is not due to an anxiety-related issue. Only if the students miss several days of school. Only if 2 adults are available to escort the student to school and someone's waiting for the student at the door, and only if the student is under the age of 11. When do we involve the police? I get asked often. If the student's whereabouts are unknown and the student is pre-middle school or likely involved in a dangerous behavior, then absolutely yes. If the student is older, likely not in danger, and the parent knows where the student might be, the parent should try to retrieve the student and return him or her to school. If there are threats of violence, threats of suicide occur, you should always take these threats seriously. Even if you think it's a bluff, you call the bluff to say, if you threaten to kill yourself, I have no choice not to exclude you from school and to use that as a manipulation against me. I have no choice but to take you to the hospital. Because if you can't handle this normal expectation of going to school without threatening violence or suicide, then that's telling you can't handle sort of a normal daily life, in which case that requires hospitalization. Traditional interventions is reducing enmeshment between parent and student, working on underlying self-esteem issues, systematic desensitization, which we talked about earlier, and helping the student improve social and communication skills. Other interventions that are school-based is sort of evaluating the IEP or the 504 plan, so making sure the school has appropriate accommodations in place, making sure, and some parents are hesitant about this idea, that medication is being properly managed and considered. I guess as a last result if possible, but consider other options such as a VOTEC, a part-time school, homeschooling, therapeutic day schools, or residential programs if the child is absolutely unable to make it back into the school. Enhanced motivation. So we maybe have children join clubs, join sports. For younger children, have them have special class responsibilities or roles in the classroom that makes them feel valuable and needed, and maybe enhances motivation to get into school. And let's say if the child is playing football and very into football, then we may have to tie, okay, you don't play football if you don't go to school. Now this might be an intervention, again, if we think it's more of an oppositional thing than a pure anxiety thing, and there's not cooperation. So school accommodations, if there's a fear of evaluation, well, actually, you know what, we already went over that, but we also want to make sure that the student has a good cover story. So if the student misses class because they have been allowed to skip in-class presentations, we also want to make sure the student has some sort of good cover story to explain to his or her peers why he missed class. We also want to make sure, as we said earlier, that learning disabilities are diagnosed properly. If the student is missing school, we want to make sure that homework assignments keep coming home. If at all possible, allow the student to photocopy a peer's notes. If possible, we adjust the amount of makeup work so that the student isn't returning to a mountain of work, because that often becomes another issue why somebody doesn't return. that their work piles up, and if they do return to work, they were already anxious about school because of OCD or perfectionism, it's going to be a lot harder to get them back to work if they have 10 times more work to do before they, before they exited the school. So which is why we want to keep the homework assignments coming home. We want to be flexible on attendance policies, but also have a deadline. The school should have a deadline for how long the student has to make progress, because this often gets families and, truth be told, the therapist focused on, okay, we actually have some goals and we have to sort of push this agenda. What if the school doesn't provide accommodations? I've been asked this recently. In fact, I faced this today with one of the students I'm working with. The family has to be willing to compromise somewhat and sort of address, okay, are the things I'm asking for reasonable? And is there a legitimate understanding as to why the school can't provide such accommodations? If you feel, as a parent, feel that the school is not being fair to your student, then you should speak with an educational advocate. There are professionals out there who are trained to advocate on behalf of families and students with schools. And the good ones will not be adversarial with the school. The good ones understand the rights, understand the laws, and sometimes have to set parents straight as to, okay, your expectations are unrealistic and unfair. On the other hand, parents shouldn't always take no for an answer. Just because something is school policy doesn't trump state law. So if the state law says that you have to provide certain accommodations and the school can't use this as an excuse, well, we don't have the staff for that, our budget doesn't account for that, that's not good enough. We have to say, okay, let's get creative and do some problem solving. Document everything. So document conversations, document the work that the child is doing with a therapist. We want for the family to be able to sort of counter any accusations that they're being negligent and not doing their job. So, and sometimes documentation just helps the family see, okay, maybe we're doing not enough. And of course, finally, we consider alternative educational options, as we discussed earlier. Some kids just flourish better in homeschooling environments. Some kids do better with online training kind of work. It's not ideal, and I know parents often have catastrophic thoughts of how will they ever learn to properly socialize, how will they ever function as a normal person, will they ever be able to get a normal job. This probably isn't very impressive for me to admit as a therapist, but I've had a number of cases over the years who didn't get back to school, but they went with some alternative educational routes, and they ended up getting pretty good educations, and all along the way, the parents were very nurturing and understanding, and I, as a therapist, would help the child work on that. And I've had kids who dropped out of high school, never went back, either got a GED, went to work, and then eventually returned to college, or did homeschooling, and sort of, without sort of having to deal with that daily crisis and extreme panic, they were slowly able to sort of heal themselves through therapy, and then they were able to be successful at college. And keep in mind, college is very different than high school. You don't have to be trapped in the same building for 8 hours at a time in college. It's, you go to a class for 45 minutes, and you go back to your dorm, then you go to the gym, and then afterwards you go to another class for another 45 minutes. So it's a very different model. So we also want to make sure the parents don't catastrophize that if we don't get the kid back to a traditional high school thing, that they won't be able to get through college. And then of course there's that other worry of, well, how will they be able to have a normal job? Well, then either we tailor their educational experience towards a not normal job where they don't have to be in a 9-to-5 trapped in this one space for the entire time, or we have faith that, again, as they continue therapy and building their self-esteem and learning skills, that by the time they get through college, they will have sort of worked on themselves enough that they can handle normal life experiences. What if none of it works? Be willing to think outside of the box, weigh the pros and cons of its alternative options, but as I said, don't panic. Consider more intensive therapies if possible. Or possibly family therapy. Very often there's a lot of damaged family dynamics. A lot of times when a child is refusing to go to school, the family becomes very disordered and dysfunctional. One person can become extremely anxious, one person can become really angry, one person can become overly accommodating. So as I mentioned at the top of the presentation, it's not just individual therapy, this often becomes a family therapy thing. Know your rights, so that's why perhaps studying on some school laws and rules and talking to an educational advocate can be a good thing. But also importantly, let's remember that the school is not the enemy, that most people in schools want to help and want to sort of achieve the same goal of helping the student be successful, but they may have different limitations or expectations than the family does. So final couple slides, key phrases to research, things that you guys might want to do Google searches on after this presentation, or go on Amazon and find books about these disorders if you believe your children are suffering from these disorders and these are the reasons they're not getting into school. Some recommended readings, really quick. When Children Refuse School by Carney and Albano, Treating Explosive Children, The Collaborative Problem-Solving Approach. This is probably one of my favorite books I've ever used in working with children and families where there is perhaps a lot of explosive behavior or a lot of oppositional behavior. I can't recommend this one enough. I'm a big fan of Ross Green's approach to treatment. So treating explosive children, the collaborative problem-solving approach. The Kasdan method for parenting the defiant child, also again by Dr. Kasdan, an excellent book. And finally, Your Defiant Teen by Russell Barkley, who's really an expert in ADHD and learning disabilities and things like that. These are all really excellent readings that have in part informed tonight's presentation. And you know, the rest is just sort of the slides about the different disorders. So I think we'll end here. And I know we have some time for Q&A.
And boy, do we have questions.
Okay.
All right. I'm going to start right into these, okay? How does a parent or a teacher answer the question, why is this happening to me? You know, my brothers and sisters are fine, and, you know, so you've got a kid that seems to have some serious anxiety issues, and nobody else in the family appears to. Right.
Okay, so in other words, helping sort of address the child's sort of sense of I'm different, I'm strange, something's wrong with me.
Yep.
You know, I think to some degree we acknowledge the reality of, you know, that we have empathy for the child, that, you know, it must be hard to sort of not to be the only one in your family. But as a therapist, I think one of the things I let children know, and it's true, is that I've worked with many kids like this over the years. And very often, you know, at least as a therapist, I can say, you know, I bet this is what's happening. I bet this was happening. My ability to and experience allows me to sort of get in their head, and they'll say, how did you know that's what I was thinking? And I can let them know it's because there's tons of kids like you who have these problems. We can even talk about the prevalency rates of panic, OCD, what have you. But then ultimately, you know, we ask them questions like, I often use sort of a disease model. That this isn't your fault that you have this problem, and that I'm operating under the assumption that you're not going to school not because you've got a bad attitude and you're a disobedient kid, but because more often than not it's because some skill is lacking, and you might have a biologically based disorder. You could have Tourette's. You could have you might be suffering from depression. You might be suffering from anxiety, and those are neurobiological issues. And so if we take it from a medical model, what I'd say to somebody is, let's say if you found out that your mom had diabetes and she was the only one in the family, would you look down on her? Would you think something was wrong with her? Would you think she was lazy? Or you know, how dare you not be able to process insulin properly? Nobody in their right mind would speak that way. So if we try and help kids understand, if you would have that level of compassion for somebody else, your job is to have that compassion for yourself. Because this work is hard enough to do without sort of dealing with somebody else's shame about not being able to overcome this. And so a lot of this also, what's important is helping the family get over their shame. What's wrong with my kid? How come they can't do normal things like other kids can do? And sort of help them get out of blaming the child and being angry at the child and addressing their own anxieties appropriately. Because I've worked with a number of children who, aside from dealing with their anxiety about getting back to school, how hard it is for them, they're also dealing with the anxiety of how upset their family seems. And man, that puts a lot of pressure on a kid. Yeah. So if the parents can have this attitude of our goal, if they can join me in that attitude of our goal isn't to get you back to school. Our goal is to give you tools to be unafraid so you can make courageous choices. And I shouldn't say unafraid. Our goal is to give you tools to do that so that you believe that you can handle this, and then you'll have the courage to try.
Okay, I've got to ask you to, I don't know if you're moving a lot, but you're kind of fading in and out a little, so kind of just stay put.
Sure.
Okay. I think next one is a really good question, and it has to do with how to build a child's day. So you've got a child that's had some school refusal issues, is going back to school. So how do you do it? Do you add gradually into the day, knowing that the child will have to face a different schedule, or should the child go to the library and have, you know, a couple classes in there? Like how do you gradually add classes in to a child's day?
Very good question. I think you start by having the child be a part of that negotiation. So saying, okay, if you were to return to school, if you had to, are there any classes you'd be able to go to that would be easier for you? And maybe we tailor it around that. So it could start with, depending where the child is at, it could start with, okay, how about you go to these classes, and the classes that are stressing you out or where you're feeling extreme anxiety, maybe during those classes you can go to the library, you can sit with the guidance counselor, and then, you know, as you're just finding that overall the school day is easier on you, then we slowly reintroduce you to these classes. Now, of course, the downside of this is then when children leave classes, they become preoccupied with how am I going to come back, what am I going to tell people, and then as a therapist, it's my job to sort of give them those cover stories and the confidence to share them and explain what's happening. But that's one method. The other method, if it's not so much about school just terrifies me all day long and it's not, none of the classes are easy, then we might start with the more kind of like, can you stay 5 minutes at a time, and then use the therapy skills you learn to slowly build yourself back up. Some other issues that we might want to assess is, sometimes children are resistant of that idea because they're afraid, someone will see them enter the building and see them leave the building. So we might want to be discreet. So we might have the child come into the school after everybody else is already inside of their homeroom, or to go to sort of a more discreet location. And if the child chooses to leave, maybe they leave when nobody else is in the hallway, things like that. So those are all things we want to assess and address. So again, I guess there's two different approaches we're talking about here. One is to just sort of make it purely about time, going into the school and maybe starting off by just sitting in the library and seeing if you can handle being in the environment and treating it like just a pure phobia that we're doing exposure work with. Or the other model is are there classes that you can handle, in which case go to them and see if you can handle them even better, and then slowly reintroduce you into the classes that you have a harder time with.
Okay. All right. On this idea of, the child doesn't, school refusal and the child is not going and is still at home, how do you handle it when both parents work and, they need to be out of that? I mean, how do you manage all that? What if you've got a child home alone, or, or can you leave a child like this home alone? So could you talk about that a little bit?
Sure. One of the parents can quit and dip into their trust fund.
I guess it depends on the age of the child.
Yeah, that's probably not realistic. I mean, it certainly is definitely a sort of a challenging reality that there's no easy answer to. But what do parents do when both are working and neither one of them can be home with the child? In which case, then we have to sort of find out what resources are available. Is there another family member somewhere around? If not, then as much as possible, we wouldn't want this to happen too much because we don't want a lot of attention seeking. But can the child come to work with the parent? Is the child old enough to go to a library and stay at the library during the school day? Again, that sort of depends also on how their age and maturity and that sort of issue. But unfortunately, there is no easy answer, and sometimes kids like this really do force parents in sort of highly unmanageable situations. And so, this might be the kind of situation where, homeschooling isn't an option because both parents the child is too young and both parents have to be at work. In which case, if all of our reasonable attempts to get the child back into school, if the school is making all the right accommodations and we're still not successful, then we may have to consider more sort of therapeutic school programs, residential school programs, things like that, where there's staff that's more trained to deal with children with emotional difficulties.
Okay. All right. So there are no easy answers there, that's for sure.
Unfortunately, no.
Yeah. Are there any statistics that address the frequency of school refusal that occurs between very highly motivated overachievers as opposed to good but more middle-of-the-road student? I mean, are there, the anxiety part of this contributes in both of those instances a lot,
right.
I think.
Excellent question. Unfortunately, I'm not aware of any research or statistical information on that. All I can give you is anecdotal experience of having worked with lots of these kind of kids over the year. And I could say it's rarely the average, at least my experience, it's rarely the average student. It's often kids on the different polar extremes. So we're either talking about the highly motivated straight A student who can't tolerate the idea of getting less than a 95 on an exam, and thus their anxiety overwhelms them so much that they don't know how to do school without being entirely stressed out constantly. So it's either, they go for a long time, they try their best to do it in their sort of perfectionistic, anxiety-provoking way, and then they burn out and can't do it anymore. That's the one typical model. The other typical model is the kid who wants to please, who wants to do well in school, but maybe has a significant learning disability, is less than average as a student, and actually aware of their shortcomings, and that comes with a lot of sort of depressive symptoms and anxiety symptoms as well. I'd say, at least anecdotally, that's been more my experience. It's the high achievers who can't tolerate the idea of being less than perfect, or it's the kids with learning disabilities who really want to do well, but the realities of their learning disability maybe get in the way. In which case, though, those are often cases that are much easier to treat, to be honest with you, because then we can provide accommodations. We can there's a lot more resources and things that we know to do with that. It's harder to sort of untrain the anxious perfectionistic mind to sort of let go of the idea of it's okay to get a B every now and then. So that's
Okay.
at the very least, it's been my experience.
This is a sort of chicken and egg question,
Okay.
but if a child has social anxiety and you know they don't want to go out, they don't want to go out on family outings, they kind of want to stay home and play games. If that's left unattended, if that's left untreated, let me say,
Yeah, that's not good.
Can school refusal be far behind? I mean, is there any connection between those two?
I mean, there's no guarantee. I wouldn't say is a predictor of school refusal. No, because some socially anxious kids can become very good at just sort of withdrawing and staying quiet, and blending into the shadows at school. So would I say it's a predictor? Probably not a predictor, but what I would say is that kids who refuse school because of social anxiety, there were probably signs outside of the school, in which case it would have been good for them to address it. So, I'd say that, yeah, in neither circumstance would I ever say it should go unaddressed. But on the other hand, we want to sort of make sure that skills deficits are addressed properly. So I'll give you an example from my personal life. My nephew is kind of on the shy side, mildly awkward, but a great kid. Love him. Really smart, really sweet, very likable, but a little bit on the awkward side. And his family was sort of really considering forcing him to join a sport or join a club or do something because they thought, they want him to sort of deal with his social anxiety and awkwardness a little bit more effectively. But the more they tried to push him into this, the more resistance they got and the less they were listening to him. And so fortunately, his awesome uncle and godfather stepped in and sort of kind of pointed out to the family that, that maybe this kid lacks a certain skill, and to throw him into the deep end, he might not be ready for. And so I got them to sort of open up a negotiation and sort of have a discussion with him. Hey, we are concerned about, how little time you spend with other people and how anxious and shy you seem around people your age. Even though he's great with adults, he's he's very sociable and outgoing with people who aren't his age, but kind of withdraws. And they had an honest conversation with him about deficits in his skills and sort of things that they have observed, and why they want him to work on this. But then they kind of threw the ball into his court. So the family has expectation. We want you to work on this. What do you think we should do? Or what would you be willing to try? And so he agreed, not to join a sport because that wasn't his thing. But basically, because he didn't want to do this, we had him say, I had him turn the tables on Mom. Mom, what would you need to see from me to have you be less anxious about my social stuff, my social skills, and what have you? And she said, well, if you invited somebody over every now and then, and I could see you sort of socializing, maybe I'd be less anxious. So in a weird way, this was a situation where the child helped the parent be less anxious. So I guess in a long roundabout way, what I'm trying to tell people is that certainly social anxiety shouldn't be addressed. Shouldn't be ignored, I'm sorry. Shouldn't be ignored, but we want to make sure that we address it at the child's ability level and what they're ready for. And we want to engage them as much as possible in negotiating, okay, what are you ready for? And if you're not ready for what we think you should be ready for, let's talk about how do we help you build those skills. But absolutely, I think, even though it might not be a predictor for school refusal, it couldn't hurt in any circumstances to help a child who's really highly anxious slowly gain confidence and develop skills that they might be lacking without forcing them.
Yeah. Well, I'm glad his awesome uncle spoke up there. All right, I think we're going to have time for one more, and you don't have to, this doesn't have to be too lengthy, but this will be it. I think it's really important for families to understand and get buy-in, in terms of extended families or situations with divorced parents. Everybody needs to be on the same page about this, and I think you almost can't stress that enough, because I think it can make a huge difference when the kid feels like they're in the middle.
Yeah.
So is there anything you want to say about that?
Absolutely. I mean, I think whenever we're discussing this issue with the child, we want, as I mentioned at the beginning of the presentation, we want to start from a place of we want to understand what's going on because your behavior is making us worry about you. But to teach the family to don't jump to conclusions. Don't just assume that the child is disobedient or willful or lazy or what have you. Ask them as much as in as open and sort of willing to learn kind of way as possible. What is going on, and how can we help you? So we have to then sort of teach all the family members to sort of be on a non-judgmental page and to put their agenda on the back burner and make it more sort of an emphasis on teaching the child how to cope more effectively rather than making it our immediate goal to get everybody back to school. And sort of as a therapist, I end up doing just as much family work often as I do with individual therapists. Sometimes it's coaching the parents how to respond when the child in the morning says, I can't go, I'm sorry, and teaching the parent not to cry or to yell or to overreact or to tantrum themselves. Again, because we don't want to sort of have this, we either don't want to activate, the child feeling shame or hopelessness, or on the flip side, we don't want to activate oppositional kind of stuff. Well, if you're going to act like this, then I'm not going. That sort of attitude. So, I think it's if we can help the families see that it's in your best interest to sort of be open, to be non-judgmental, and to not overreact. That's important. And I've also, like for kids who are missing several days or even weeks of school, we sometimes have them sort of, if they're close to their extended family, talk with the extended family, explain to them what's going on and what their struggles are. So that, again, there isn't this sort of I'm keeping a secret and I'm so ashamed of this. It's more like, okay, this is a problem I have, but I'm working on it.
Okay, fair enough. Well, I think we're going to wrap it up here. Thank you very much. A really lot of great information. Appreciate your time, Dr. Zambrano.
Thank you.
Thank you for joining our webinar on school refusal. There is an exit survey which we need everyone attending to fill out. The discussion board is now open and available for the next 7 days on the NJCTS website for any questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted on that website. Our next presentation, Cyber Safety Guide for Parents and Educators, will be presented by Dr. Graham Hartke and is scheduled for next Wednesday, October 16th, 2013. This ends tonight's webinar. Thank you, Dr. Zambrano, for your presentation, and thank you, everyone, for attending. Good night.